Hi, I'm Dr. Janelle. I'm going to share 3 case studies with you because what I've noticed along the way of using the GI1 protocol is that it's not only impacting the fermentation issues, the gas and bloating that people are having with SIBO or with SIFO or dysbiosis, but it's also impacting intractable constipation and intractable diarrhea, whether that diarrhea is an inflammatory bowel disease, an IBS-D, or some other cause. So here's the history of this treatment in 30 seconds. I started the sulfur treatment, first of all, for GI fermentation decades ago, before SIBO was even on the map. And then the SIBO antimicrobials started happening around me, so whenever I saw a SIBO patient, I would do my sulfur protocol. And then I started seeing patients who had failed rifaximin, metronidazole, erythromycin, neomycin, biofilm treatment, motility treatments, fermentation diets, elimination diets, carnivore diets. So these people have pretty much been through everything. Now, this sulfur treatment is very aligned with a natural philosophy. It's almost a nature cure. It's something that has been used for centuries. And I have had success rates over 80% all over the world using this treatment, regardless of what people have tried in the past. So I think that for the most part, once you try this, you won't look back. And again, what I found is as I treated more and more patients, I was seeing impacts on inflammatory diarrhea as well as intractable constipation. And there's so many reasons for that, right? Because this treatment's antimicrobial and antifungal, it's also healing. So it's providing you with that really important mucus layer that divides the bacteria in your gut from the cells in your gut. Good fences make good neighbors. So in this case, you don't want those bacteria to touch the cells of your gut because that would trigger an immune response. So that mucus layer is incredibly important, and it is sulfur-based. So first case is going to be a woman who had onset of her symptoms in 2015. She had triple antibiotic therapy for H. pylori, which we're now starting to question as a good first option. And then after that triple antibiotic therapy, she had bloating and the onset of upper GI pain. So obviously those intense antibiotics impacted her microbiome and shifted her towards a fermentation species, whether it was bacterial, fungal, or both. So over the course of the 10 years until I saw her, she had several courses of rifaximin or Xifaxan, the antibiotic. She had several positive SIBO tests, always coming up with high levels of hydrogen gas. So she took more SIBO tests and more antibiotics. And then I saw her in 2025. We did my sulfur protocol with the GI1 powder. And her SIBO test is now completely normal for the first time in 10 years. Let's go on to a constipation case. So in this case, this is a person who's a 44-year-old female, and she had her onset of her symptoms in 2022. It felt like an ulcery sort of hunger pain in the upper GI with bloating. That symptom would come and go. She went to see a gastroenterologist, had all the scopes and all the scans, and what they found, the only abnormal they found, was a high ejection fraction in the gallbladder of 96%, which meant she had a hyperkinetic gallbladder. The gallbladder is squeezing really hard when it's time to send the bile out to digest fats. So she was offered a cholecystectomy, removal of the gallbladder. She declined that and went to check for other treatments. So she saw a SIBO doctor. She had a positive hydrogen breath test in 2023 and several of those afterwards. She did all of the low fermentation diets. She tried grain-free diets, gluten-free diets, low FODMAP diets, low acidity diets, carnivore diets. And when I saw her in 2025, she was avoiding gluten. Primarily she was grain-free, and she was limiting dairy, even though she didn't think dairy was a real trigger for her. So in 2023, She had tested for the hydrogen-dominant positive SIBO. She'd had rifaximin, Xifaxan, herbal antimicrobials interface, more herbal antimicrobials, and then teamed up Xifaxan and metronidazole. All of these helped a little bit, but the bloating returned and the symptoms returned after 2 weeks. So that really makes us want to consider that if the symptoms return, you haven't treated the cause. And these are broad-spectrum at least Xifaxan's a broad-spectrum antibiotic. It should be able to take care of it in 1, maybe 2 courses. So if it's not, then it's time to move on. When I saw her at her first appointment in 2025, she told me that she was having a bowel movement every day, but it was incomplete, and she had to use a lot of support to have that happen, like magnesium citrate and something called Modal Pro. She was having upper abdominal pain, still that gnawing ulcer-like feeling, and lower abdominal gas and bloating. So all I did was have her start on the GI1 powder, have her go up to a 10-gram dose, and then we talked again to see how she was. She said that her pain had improved, her bowels were soft and easy to pass, they were complete, and she was off all of the other treatments that she had been using to have that happen, like the Modal Pro and the magnesium citrate. Her abdominal pain was better, that upper gnawing abdominal pain, and that her bloating, the lower abdominal bloating, was decreasing, but her gas was increasing. This is normal because in the beginning, in the lower doses, the GI1 powder is a prebiotic, so it's actually feeding all species indiscriminately, meaning that they're going to create more gas, but the point is it's like deflating a balloon, right? The gas, the bloating is going down and the gas is passing. So fast forward to her being on her full dose for 8 weeks, and then we talked again. She said at that point her bowels were soft, she was having bowel movements every day, and she was having a full evacuation. She said that her gas was gone, her bloating was gone, and that upper GI gnawing pain would come on only if she ate a high-fat diet and only with meals. So in my opinion, that really has to do with the hyperkinetic gallbladder, so I referred her back to her gastroenterologist to decide at that point what is the best course of action. And interestingly, she was using the food marble at home to test her gases, and she noticed that she was no longer high in the hydrogen-dominant SIBO. It just wasn't coming up on the food marble, but she was having some methane gas release. However, we know from some of the studies that 30 to 50% of the normal healthy population releases methane gas. They don't have any symptoms. They're not, having a problem with digestion. So I don't think that's really a big diagnostic target for us. Third case, diarrhea. This is a case of a fellow who's 48 years old who moved about 10 years ago to the Seattle area. And prior to that, he'd been treated for a year with omeprazole, a PPI, for reflux, and his symptoms worsened after this treatment. So for that 10-year, 12-year span, he'd been seeing many, many different doctors and tried many treatments. He did find out along the way that dairy made his symptoms worse, but it didn't stop them. He'd had a colonoscopy in 2019 and an endoscopy. Those were normal. I repeated his celiac serum testing in 2025 when I saw him because I just wanted to make sure that that didn't become activated since 2019. He says, when I saw him, that he wakes up between 3 a.m. and 7 a.m. every day with cramping, urgent diarrhea, and is up 5 times a night with this. He has abdominal pain, which is pretty normal if you're having cramping diarrhea, but that abdominal pain persists for the first few hours of the day in the lower pelvic area. He's passing a lot of gas, both flatulence and eructation, and he's bloating all day long. It never goes away, but then it just gets worse at nighttime as he's sleeping, and then the cycle starts again with the urgent diarrhea. So I put him on the lower dose of the GI1 powder, the dosing that I use for inflammatory conditions like IBD, Crohn's ulcerative colitis, as well as all the other intractable diarrhea conditions. We did 2.5 teaspoons. We did 2.5 grams, which is half a teaspoon for 7 days. And then it had an increase to a full teaspoon, which is 5 grams for 7 days. And then continue on with that. And then we talked. And he said his stools were formed normal, his bloating was gone, and his pain was gone for the first time in 12 years. He was no longer waking at night with urgent diarrhea. And then he asked me, why aren't other people doing this? So here we are. I want to make sure that you know that this very safe, very natural treatment is an option for you and for your patients to get rid of fermentation issues, gasiness, bloating, as well as to get some recovery from intractable constipation and from intractable diarrhea.